Hi, this is Jason Orcena, Health Commissioner for Union County, bringing you an update about our COVID-19 response and our efforts over the last week. To begin with, let's talk about the number of cases. We have reached 9 cases within Union County. Of those 9 cases, we haven't had any hospitalizations, and 6 of those individuals that were stricken have recovered. The ages for the individuals who have had COVID-19 so far range from 31 years of age to 83 years of age. In our efforts to slow down the spread and deal with COVID-19 in the county, a lot of it has focused on Med Surg. We've talked before about what Med Surg means, and essentially that is when the ER in our hospital system becomes overwhelmed by the number of cases. Now, over the last couple of weeks, you've heard Dr. Amy and the governor talk extensively about how we have made a difference and we have lowered the number of what that Med Surg would look like and have delayed that through all the efforts everyone at home has done with the sacrifices you made by staying at home during the stay-at-home order, by limiting your trips outside. That has given us time to really focus on our Med Surg planning. To date, we have 2 tiers to that Med Surg planning. The first tier is what we call our Ask a Medical Professional, basically a phone line for folks who are suffering symptoms, have illness, etc., that can call in and ask advice from a medical professional. The second tier is an actual drive-through medical clinic or a sick bay operation that could support the ER if the ER was inundated with cases and overwhelmed. For both of those, planning has gone along fairly well at this point, and the Ask a Medical Professional is actually, planning is complete and could be stood up within a couple of days' notice if a surge begins within Union County. The other, the drive-through medical or sick bay, is still in the planning stages, but moving along, progressing very well. The other thing we want to cover again today is we've had a number of reports about older adults still making a lot of trips out into the community. As you are aware, for our older adults who may watch this or their family members, older adults are a particularly vulnerable population, and we want to really encourage and support our older adults relative to their daily needs. So if you have family members, friends, neighbors who may fall into that vulnerable population, please continue to reach out to them and ask if there's anything you can do to help with their shopping needs, whether it be for groceries, household products, what have you. If there's something you can do, please consider asking if they would like your assistance in doing that, just to, again, keep them at home to the extent possible and keep them safe from exposure to COVID-19. If there are other needs an older adult may have within our community, 211 has a fairly extensive list of resources that are available for those, and we encourage you to reach out to those folks and give them that information. Again, 211 is the number. You can call those folks and they can help put you in contact with other resources for older adults. As we enter the weekend, we want to remind everyone again, stay home, stay safe to the extent possible, limit your trips out when you and where you can. Everything you've done has made a huge difference in our community and the spread of COVID-19. Your sacrifices have made a difference. We appreciate every one of you who have done that for us every day. And again, as we go into, thank you to all the workers, all the essential folks that are out there helping us keep our community safe through this trying time. Thank you.